this one. It is depending upon you whether you want to expose this patient or you whatever radiograph you have, you can do with that one. So it's always there is a dilemma between risk versus benefit. So he will decide when to prescribe or when not to prescribe a radiograph. So in case of children, primary dentition, they're divided into primary dentition or mixed dentition. They have a recall patient. If there is primary dentition in the new patient, you will go for posterior bite-wing, or mixed dentition, maybe individual examining of the clinical examination with periapical or bite-wing examination. If you call this patient for after 6 months or depending upon the clinical examination or history of this oral hygiene history, if there is a patient is a high risk category, then you will recall this patient in between 6 to 12 months for bite-wing radiograph. If there is a low risk caries category, then you will send this patient for 1 to 2 years interval for posterior bite-wing. If there is any periodontal disease history or poor periodontal history of this patient, you will go for individual periapical or bite-wing radiograph. And if there is any growth or development in the primary dentition, it is not indicated to have any type of radiograph and individual examination. You will go for periapical or bite-wing radiograph. In case of adolescents, in the new patient, you may go for 20 cms depending upon the patient need. Okay, it is combined with periapical and bite-wing radiographs. The recall, again, same bite-wing for 6 to 12 month interval. High risk and low risk categories will be 18 to 36 month interval. And periodontal disease, maybe individual need of this patient, you will go for periapical or bite-wing radiograph. And growth development, maybe you'll go for panoramic radiograph, or if you want to assess third molar, you will go for third molar. You will go for periapical radiograph. In case of adult, if it is dentulous or elderly patient, in dentulous patient, you may go for CMS or selected periapical or bite-wing radiograph or panoramic radiograph or CMS for dentulous patient. For high-risk category, posterior bite-wing, 12 to 18 months interval, or low-risk 2 to 3 years interval, and periodontal disease, depending upon your need, you will go for periapical or bite-wing radiograph. And for growth development, it's not indicated. Okay, so these are for 2D views. Okay, and lastly will come our most commonly used 3D view, CBCT, in dentistry. So you will not prescribe this one without any useful history or clinical examination have been performed. In our hospital, even if the doctors from other department order the CBCT, they need to take approval from us, from the maxillofacial radiologist. If we don't allow to take CBCT, or if we think that this particular patient don't need CBCT, we will not allow to take this CBCT. So we don't want to the patient to be exposed unnecessarily. Sometimes in simple third molar extraction, which is not very near to the maxillary sinus, tuberosity, or inferior alveolar canal, we don't allow this patient to take exposed for CBCT. So it is very important to have the previous clinical examination and history of the patient for ordering the CBCT. And as we mentioned, must be justified for each patient to ensure that they will benefit from this, from the risk of ionizing radiation, but the patient will be benefited if we take this CBCT. And also, in the suppose there is a impacted third molar, which is the most common cases ordering the CBCT here, which is very near to the sinus floor or very almost touching the periapical inferior alveolar nerve. So we may allow this patient so that we can clearly see whether exactly touching the nerve or the maxillary sinus floor, so that additional information will be added to the periapical radiograph, what we have already had, so that we will allow this patient. Or sometimes there is any benign tumor or malignancies. You need to see the extent of the disease, buccal swelling of the disease, the 3D views. So we'll allow this patient for CBCTs. So sometimes there is endotheted or there is a broken file, or there is any perforation, if there is any fracture of the teeth, if there is any missing tooth or missing canal or complex morphology of the canal in case of endotreated, if there is any calcified canal, so we will allow this patient for CBCT. Or the root canal is obturation material, separated endodentin treatment or perforation, we'll allow this patient for CBCT. Or sometimes you need to localize the root apex, the proximity of the adjacent anatomic structure, as you mentioned, whether it is very close to the mental foramen, inferior alveolar canal. Okay, but before surgical placement of the implant, we do implant planning in the CBCT. And also, if there is any dental alveolar trauma, fracture, luxation, displacement, or alveolar fracture, we'll go for CBCT. Or if there is any external internal resorption of the tooth or teeth, you will go for CBCT, and we'll allow this one. So this is the guideline been given into the book. So to assess the anomalies, evaluate the dental alveolar boundaries, craniofacial scaleal asymmetry, maxillomandibular discrepancies, evaluate the TM joints, not the disc, but the bone, and the airway morphology, the plane of combined orthodontic or orthodontic surgery, optimal location of the temporary anchorage device for the mouth treatment, or if there are any skeletal or dental changes. So you will allow this patient for, you can order this and CBCT. There are some special consideration, especially for pregnancy. People are worried about taking radiographs. Even if there is a periapical radiograph patient. So in the clinical history taking of this patient, for all the women, which is in the fertile age, suppose 20 to 30, 50 years old. So you may ask this patient whether, married patient, whether she is pregnant or not, so that you can take precaution. And you need to choose your radiograph in case of any pregnancy. If you take proper precaution, there is no harm of taking radiograph, because it is proven with that the risk of or ionizing radiation have been given to one particular periapical radiograph is 42,000 less than what will cause an ionizing effect on the embryo. So it is very much safe, but sometimes people are worried. So you need to assure this patient, if it is needed in terms of pregnancy, in pregnancy term, if it is needed to take radiograph, you may go for this one. And also, you need to take special precaution for not only for the pregnant patient, for all the patient. You'll use the guidelines, the radiation protection. You will use the lead apron with thyroid collar and protection for every patient. So not based on their being diagnostic need. The pregnant patient as well patient which is who are not pregnant, or for all this patient you will have the same precaution you will take whatever been given in the radiation protection guideline.